Right. Well, hello again. I'm Richard Power. I'm member of Rotary Club of Leicester, but my day job is a medical examiner at Leicester Royal Infirmary and also semi-retired orthopaedic surgeon. And I've been giving some updates on the COVID-19 pandemic over the last month or two for the club, from my perspective as a clinician and also relatively inside position as a medical examiner.
Thanks, Richard. And I'm Parmdeep. I'm soon to be president of the Leicester Rotary Club, and I'm really pleased to have Richard here again. There's been a lot of demand from your fans, Richard, to have you back. Sure, you'll be glad to know. So yeah, what's happening with the Leicester lockdown then? Let's get straight to the meat of it. What do you think?
Right. Well, I mean, first of all, it's been grumbling around for the last week or two that there does appear to be an increase in cases, particularly in East Leicester, and this sort of hit the press today with the Sunday Times front page and subsequently the BBC and others. I mean, looking at the actual reality of the cases, it does appear to be predominantly in East Leicester, and interestingly, but not uniquely, within higher clusters within those firms who are involved in the food processing industry. And we obviously, Leicester being very high profile from that point of view, has a number of fairly major food processing plants, and there are various reasons for this. I mean, it's partly because the actual working conditions in food processing plants lend themselves very much to viral transmission of anything, whether it's COVID or anything else. I think specifically the concern within Leicester, if you look at the workforce who work in our plants, they are predominantly of an Asian or East European background, and as we know, the Asian community does seem to have been harder hit by this than other communities, and there are a number of potential reasons for this that probably all coalesce. We know that vitamin D deficiency is higher within the Asian community. We know that diabetes is higher, and also the social structure within the Asian community lends itself to transmission within families, and you often have multi-generational families living together. So there are a number of factors that all come into play here that might be problematic. Having said that, the last day I worked was Thursday, and the last couple of weeks our mortality rate's actually been below the seasonal average, and the number of patients in the hospital being treated for COVID-19 has remained largely static, in the 70s, which is much lower than it was obviously at the height of the pandemic. So where, as I've said before, having an increase in cases per se isn't necessarily a bad thing, if provided it doesn't then convert into patients becoming seriously ill with the COVID-19 pneumonitis, which is what actually is the main worry. Because and I looked at our data on Thursday, and it remains at 75% of the in-hospital deaths, it doesn't include the care homes, are 70 or over. And so if you actually add the care homes into that, that actually potentially would go up even higher, because obviously all the deaths within care homes are going to be patients over 70, pretty well all. So that is not the working age group that are the people we need to worry about or look after and protect, is the elderly. So that's where the efforts need to be targeted. So that brings on to the question of lockdown. Now, obviously, lockdown can be anything from your sort of Chinese version to having roadblocks and shutting everything down, having curfews on the one end of the spectrum, to the other end of the spectrum, just advising people that they've just got to be sensible. And because it's a very difficult, if you're going to do a limited lockdown, just to say, let's just say Leicester City, it is not as easy as it may seem, because you've got obviously lots of workplace, a lot of work going on, a lot of industry, and people moving in and out of the city all the time, and so it's going to have a lot of thought before it's introduced. I think Peter Soulsby was fairly sensible this morning when he was saying, look, come on, we mustn't jump to any quick conclusions. We must look at this data sensibly and correctly, because it's very easy, particularly with 24/7 news agenda, to be sort of rushed into making quick decisions without really thinking through the consequences, which so it just does need to be given serious thought, because if we don't get this right, then if you then get surges elsewhere within the country, then it will be making it much more difficult to then react accordingly. So I think we'll just have to wait and see, obviously, these. But at the moment, as I say, although there may be an increase in the number of cases, that isn't translating into people being seriously ill.
So can I take you back to something you said earlier about having been tested positive, but then it's okay if it doesn't become something else? What was that, and how does that work, where you actually end up in hospital?
The interesting thing about this virus, I mean, it's not unique, but it presents from anything from absolutely no symptoms whatsoever up to being a fatal pneumonia, So as I've said previously, I mean, for the vast majority of fit, healthy people of working age, if they do contract coronavirus, the likelihood, the worst case they're going to get is just feeling pretty grotty for a couple of weeks and probably a bit of a cough for a bit longer than that. So it's no worse than any particular flu problems. So I got some dogs under my feet.
Okay. Can you show us one of them? They're puppies, aren't they?
They are puppies, yes, but they're a little bit out of control at the moment. Here we are. There's one coming over now. So here we are. This is Bumble. There we are, Bumble.
Hi,
there
Bumble.
What's that going? Anyway, right. You're going to go down. Yes. You go outside now. There we go. Right. So I've lost my train of thoughts now. Where would you go up to? Yes, so the spectrum of illness.
Yeah.
So therefore, you've got to tailor the treatment to the disease. And lockdown is a very blunt instrument. It's and it's a blunt instrument that carries with it huge side effects. So it's a blunderbuss approach that I think, given the fact that we know a lot more about the epidemiology of the virus and those who it affects, we can afford now to be much more selective about how we approach it. And it's very tempting to be driven by the media and into being panicked into going down the same route again.
So I guess the question here would be, what would you do then if you
What would I do? Well, I would do what I've said all along. Is that you've got to, for those who we know are vulnerable, which is the elderly and those who have other significant comorbidities at a younger age. So if they are particularly overweight, diabetic, or have significant lung disease, those individuals just need to make sure that they protect themselves, and that their families are vigilant, and that the care homes obviously other key areas as well. But shutting down the rest of the working population doesn't add any more to that. It doesn't make their lives any safer by shutting all the shops up or restaurant, or they're open at the moment, but all takeaways or anything else. So it has to be focused on protecting those who are at risk, because I really there is a belief abroad that this is a dangerous illness for everybody, and it isn't. And therefore, and given the fact that we're a long way off having a vaccine, if we get one at all, the virus is not going to go away. It's not. It'll have its ups and downs, and there being plenty. There was an epidemic called the Russian flu epidemic in the 19th century, which is now possibly thought to be not a flu but coronavirus, and that the initial wave was pretty devastating across Europe, but the second wave the next year was much less so, and it just gradually got less and less because people developed their own innate immunity, and also the virus probably it started to lose its virulence. So we have to adapt our approach to it, otherwise we're going to end up with no society left if we're not careful.
So do you think we've ended up using such a blunt instrument, even though I agree with you it's probably not the right one, mainly because of political pressures, and so we've been forced down that road?
I could go on for hours about this one, and I do. I mean, if you look at the history of the virus right from the start, I mean, it originated in China, and after the Chinese government clearly initially tried to sort of pretend there wasn't too much of a problem, they then slightly panicked and they did what only totalitarian countries know what to do, which is just shut everything down. And then the first sort of the first European outbreak was in northern Italy, and again. It may be that because they were the first health service to be impacted, they weren't geared up to it, and so their health service really struggled. And the WHO likewise followed the same tune. And I think it was a degree of, well, we've got to be seen to be doing something, but we don't really know what to do. So lockdown seemed to be the thing to do, and that I think probably explains it. And because we live in an age of social media, 24/7 news agenda, and once the government got into giving daily updates, then they then feel under pressure. They've got to produce something new every day, otherwise why are you there? And so it's sort of the whole thing tends to then spiral beyond that. It will be fascinating to look back in a year or two's time at all this and say, well, was this the year that the world lost its marbles? I don't know, but time will tell.
So it's sort of like the tulip bubble for the
tulip bubble, South Sea bubble. Yeah, exactly. Yeah. So I mean, there have been plenty of things in history which have demonstrated man's ability to slightly lose perspective, shall we say.
I mean, I've been very impressed with a guy called Andrew Cuomo, who's the governor of New York State.
Yeah.
He's been very good at giving daily briefs. I believe they're daily, but certainly regular briefings on sort of the state of play in New York and presenting lots of data and what's happening and what he's doing about it. Why don't we have something like that in Leicester? I mean, couldn't we pick out an epidemiologist or a virologist or yourself or the mayor? Why can't someone do that for us?
Well, for a start, New York is a shed load larger than Leicester, and so New York effectively runs, as its economy and state is as big as a small country. So and because and don't forget the states run a much more disparate healthcare system and sort of political leadership than we do in this country. We're much more centralized. So you couldn't you're not going to get an epidemiologist in Leicester stand up and say what he thinks when Dr. Whitty or Professor Whitty will say, well, you may say that, but I'm the guy in charge. So the public health people on the ground will be involved in local decision making. I don't know if you've watched the Salisbury poisoning dramatization, but the public health person in charge of public health had quite a major role in setting the agenda for the localized Salisbury lockdown.
Okay.
So they do have very much a significant input on the ground, but they wouldn't really be in a position to put their head above the parapet and give a briefing. I mean, as you know, Peter Salisbury, I suppose, is the nearest you're going to get to it from the city's perspective.
Yeah. I just think it'd be nice to have somebody local giving us some information as opposed to trying to find it on BBC News or some other place, you know.
Well, I mean, certainly I agree with you, but unfortunately, the system we work with doesn't really lend itself to that.
Yeah, no, fair enough. So at this point, would you say people should be worried? Because I get the sense that people are quite worried, just judging by sort of messages on social media and that sort of thing at a local level.
I think they are worried simply because we've been, from the outset, we've been made to worry about it. If you see what I mean. I mean, we live in an age where we're not, because of antibiotics and the vast improvement in just our general way of living, we're not used to having infectious diseases causing problems. 100 years ago, it was just part and parcel of life, and pneumonia was referred to as the old man's friend because that's what happened. And we've lost sight of that, and we've also rather forgotten that sadly we all die, and we have to recognise that is part of life, so we have to understand that if we're going to live life to the full, that does require an element of risk taking. We take risks every day when we get in the car and go to work. We get on a bicycle. If we overeat, we always take risks with everything, and that includes being prepared to take risks with the fact that we might catch a disease that, unless you are elderly, is very unlikely to do you a great deal of harm. Obviously, there are always exceptions to this, as there are well-publicised ones, and can't completely belittle it. But we've got to remember that the long-term impacts of things like lockdown are profound. The NHS has been put back 20 years from this in terms of accessibility to elective care. When I started as a consultant in Leicester 25 years ago, it took 18 months from when your GP saw you to finally getting a hip replacement. So it was 6 months waiting to be seen, plus a year to sitting on a waiting list. We got that down to 18 weeks 2 years ago. So that was 6 weeks to be seen, and then 12 weeks waiting. And it's now, there has been no routine elective work done in Leicester for 6 months. So that's automatically added on. And in some parts of the country, I know Northampton, they stopped doing elective work in October, November because of the winter pressures. So, and things are not starting up now, and they're not likely to start up properly this year. So that, these are profoundly damaging effects of lockdown, and that's before you even touch on the economic effects of jobs and just society as a whole, leisure industry, sport, travel, holidays. These are real, and they affect us all in this country. And then you just look globally what it does to countries in the African countries, for example.
Well, we've ended up at an interesting place in the conversation, because one thing I like about speaking to you is you kind of have a very good overall view and big picture, as opposed to, say, the average person, including myself, who's being bombarded with short-term social media and the news cycle. So how would you advise, or what sort of advice would you give somebody watching this who would want to kind of reframe themselves a little bit and try and have more of a big picture view? What sort of information sources should they be looking at, and how should they be thinking about things?
Well, I think the first thing I would say is if you are fit and healthy and working age, the first thing is to just stand back and say, look, I've got to have a perception of risk here, and that not be frightened of catching this in the same way as next year when we get a flu epidemic, you wouldn't be terrified of getting flu. There was a nice thing circulating on WhatsApp last week with and it's a cartoon. Flu says to coronavirus, you know, I kill more people than you do. Coronavirus says back, yes, my marketing's better. And you know, that's the position we're in. There's a culture of fear about it, and so I think the absolute first thing I say, look, you know, you gain nothing by being frightened of this. And I think, you know, people say, oh, well, you know, that's putting people off going back to the shops and everything. I think actually what's putting people off going back to the shops is having to stand outside in the pouring rain in the 2-meter queue, waiting to get in, when they can go and click online and get it from next door from Amazon delivered to their kitchen. So I think that's the first thing. I think also it's being realistic to older people, because we're being, I think, to a certain extent, quite patronizing to people over 70, saying you are not allowed out. Surely that is their decision, because many people towards the end of their lives, you know, they accept they're towards the end of their lives, and they actually value seeing their grandchildren and their children and having a social life. And that probably is more important to them than the possibility that they might contract COVID pneumonia, which might bring their lives to an end a year or two earlier than otherwise would do. So that's a personal choice for them, isn't it? It's not something we should be dictating to them if we pretend to live in a free society.
Interesting. Yeah. I suppose that kind of risk assessing view, the actuarial view of things, is not something that comes naturally to most people, whereas for you, it's a trained. That's how you train. That's how you think. You're thinking in probabilities all the time, right?
Well, it's like school children. I mean, school children are more likely to die of being struck by lightning than they are dying of COVID pneumonia. And you know, and so those are the things. You know, we don't have a perception of risk. We're very happy to put a pound or £2 a week on the national lottery. Our chances of winning that national lottery are less also than being struck by lightning. So you know, you know, those are when I discussed doing a hip replacement on somebody who's in their 80s or 90s. And who's got various comorbidities, and you have a straightforward conversation saying, look, you've got a choice here. You either accept that you've got a chronically painful hip that's going to ruin the rest of your life, however long that is, or you can have an operation which will get you out of pain and get you walking again, but there is a 5% risk that you might not make it. And I have to say that in all those conversations I've had over the years, I think the number of patients who've said, I'd rather not take the risk, is probably on the fingers of one hand, because they don't want to live the rest of their lives in chronic pain. And that's no different to a certain extent. You're left the rest of your life holed up on your own, not being able to see your nearest and dearest, other than on FaceTime or whatever.
Yeah. Well, thank you very much for that rational view of things, and for bringing us all back to perspective. So, unless there's anything else you'd like to add?
No, I mean, as I say, you know, from the hospital perspective, you know, it's all good news to a certain extent, in the sense that you know, we're well beyond we had about a 6 to 8 week period where it was hard, but it's much better now, and let's hope it stays that way. Yes, and I would encourage people to get outside in the sunshine and not sit at home cooped up, because sunshine's good.
We say that as we're cooped up inside.
Sorry?
I said that we're saying that as we ourselves are cooped up inside today.
I know, that's right, but it is the evening. Anyway. Yeah. All right, okay, cheers. Sadly, I won't be at the meeting tomorrow because I do have to attend a Zoom funeral of a colleague of mine.
Okay.
So that's rather sad. But,
yeah, well, keep up the good work and all the best to you and your colleagues.
Yeah, thanks very much, Barndeep, and have a good meeting tomorrow.
Thank you. Bye. Yes.